Hello and welcome to Sedona Wellness Retreat. I'm here to show you how to do one of our most important therapies here, the coffee enema. I just want to note before I get into this that you should definitely speak to your doctor before attempting any coffee enemas. Your doctor will tell you if it is appropriate for you to do and how often it is appropriate for you to do. But I'm going to guide you through the process of doing it. First, I'd like to introduce you to your wellness handbook here. If you haven't seen this before, this is a handy guide to many of the therapies we do here. So a lot of the questions you have will actually be answered if you just take a look in the table of contents and look up the topic. And so right now we're going to look at self-administered therapies and go to the coffee enema section. And so it's 55. And so I encourage you, before you do your first coffee enema, to just familiarize yourself with the information here about coffee enemas. We go into the mechanisms and the history, the preparation of the coffee, which you don't have to do here, we prepared for you here, to a quick guide, to a more detailed guide, and so on, and cleaning up after enemas. So all the information you need for most of the things we'll ask you to do is actually in this handy book here. And so the first step in doing a coffee enema, of course, is to set up your enema bucket. And it's very simple. So your enema bucket kit will look just like this, and there might be some more plastic wrap, but you remove the plastic and take these pieces out. And you're just going to attach this tube here to the little knob on the bottom of the bucket and just push it in as far as it goes, and that will hold nice and tight for you. And then on the other end of this tube we have this special connector piece, and this is the catheter, and so this large end of the catheter just connects right here. And once you've assembled your bucket like this, you can leave it like this for the duration of your stay. You don't have to take it apart, and you can store it just like this. And you notice the catheter snaps into the top of the bucket there. You'll also be given a lubricant to do the enema with, and we'll talk a little more about this later, but this is the most common one we use. It's called unpetroleum jelly. It's a non-petroleum, non-toxic based lubricant. This one is a more herbal-based lubricant that has some herbal medicines in it that help with hemorrhoids and fissures and things like that if you have a history of those things. Your doctor will let you know which one of these is most appropriate for you. So before I teach you how to do the coffee enema, I would like to show you the contents of this mysterious box that you may see in your room. And so there's a lot of materials in here that will be useful for your coffee enema. So we have a spray bottle and some hydrogen peroxide. And I'll show you how to clean your enema bucket later. That's what those are for. You have a hot water maker. I'll explain what this is for a little later as well. You have your own personal supply of napkins, and that's for cleaning up during and after coffee enemas. You have some little garbage bags here. That's in case there's any mess from the coffee enema. You have these special absorbent pads, and this is to confine the mess if there is one when you're doing the coffee enema. There are a couple of brown towels, and I'll show you what to do with those in a moment. There's a spoon. Now the spoon is used for something called the castor oil treatment. It's not something you have to worry about right now. And then there's this little laundry bag. And so this is where you put your dirty clothes, and the housekeepers come around in the morning to pick up your dirty clothes, and they'll wash your clothes once a week. You just put it behind your door or right outside your door, and they'll pick it up for you. And the last thing is this pad, which should also be in your room. And this is for laying down for the coffee enema. Now, if any of these things that I showed you aren't in your container, let the innkeepers know, and they'll make sure that they get them for you. Now that we've explored all of the supplies you'll need for your coffee enema, it's time to set up your space to actually do the coffee enema. So you'll start with this big pad, and this is what you'll be lying on. You want to just set this on the floor. It's a good idea to have it pretty close to your bathroom. There are sometimes when we're doing a coffee enema that the need to release it will come up suddenly, and it's a good idea to be near a toilet when that happens. So we put down the pad, and then the next layer is the brown towel. Just place it in the center, just like this. And then we take one of these absorbent pads, open it up, and place it absorbent side up right in the center there. And this is where you'll be laying with your bottom right over this pad. It's a good idea to put down this container right here, and I'll explain why later. And it's also good to have this quick guide to enemas nearby in case you have any questions or any panic that comes up in the middle of your coffee enema. This explains the whole procedure. And the only other thing you need, besides, of course, the coffee bucket, is some kind of a timer, because our goal is to hold the coffee enema in for a full 15 minutes. This is the coffee and juice station, and this is the coffee enema concentrate. This is provided to you by the kitchen, and it'll always be here. This is a special coffee made specifically for coffee enemas. It's actually called a gold roast, so it's lighter than light roast. And of course it's organic. So, our first step in creating the coffee enema solution is to get a jar, which you will find right here. And most of the jars in here have special little hash marks that will help you measure the coffee. And in your coffee enema bucket, you will have one of these very simple recipe sheets. And most people are going to start with a 16-ounce coffee enema. So we're just going to follow these directions here. 16 ounces total. So 4 ounces of this coffee concentrate to 4 ounces of hot water, and then 8 ounces of room temperature water. So the first step is to fill this jar up to the 4 ounce mark, which is this first little notch. You'll see there's an 8 here, and there's 16 here. So that tells you how many ounces. So this first one's 4 ounces. So we're just going to fill this up to the 4. There we go. And notice I didn't need to remove the cap or twist it at all. And the next step is to add the water. So we're going to go right this way to the water station. So this water station is an important source of hot water and room temperature water. The water that comes through these taps is filtered through reverse osmosis, which removes most contaminants. And so what we're going to do is just make another reference to our recipe here. And the next step is to add 4 ounces of the hot water. And again, that comes out of this. So this is a little tricky because you have to look deep into the sink while you do it. Bring it out, make sure that it's about 8 ounces. Good, so we just added the 4 ounces of hot water, and the last step is to fill it up to that 16 mark with room temperature water. All right. And this is complete now. It's a good idea to do a finger test. And you put your finger in, and it shouldn't feel hot or cold. It might feel a little bit warm. And that tells you that your colon's going to be happy with what you're putting in it, because if it's too hot, you'll irritate the colon tissue, and then it'll be difficult to do other coffee enemas in the future. If it's too cold, your colon will constrict, and it won't let you hold it in. So our goal, the reason we have this recipe the way it is because that brings the temperature of the solution to approximately body temperature, and that's the goal. Okay, and now we're ready to go actually do the coffee enema. So now that we've mixed up our coffee enema solution, it's time to do the coffee enema. And it's important to do this within 15 minutes or so of mixing up the solution, otherwise it's going to cool down. And so the first step to this is to get your bucket ready. And what we're going to do is we're going to pour the coffee into this bucket and then bleed the air out of the line. So we're going to pour it in, and as soon as we start to see a little bit of coffee coming out of the tip of this catheter, we're going to clamp it off with this. And that will get all the air out of the line. Here we go. Pour it right in. You can see it's gone through the tube. Oh, now we'll give it a little bit of gravity. There we go. I'll clamp it off. So now that we've added the solution to the bucket and gotten all the air out of the line, it is time to insert the catheter and begin the enema. So we're going to measure about 6 to 8 inches. So that's from the tip of our middle finger down to roughly the base of our palm. And so you mark that off with one hand. And this might seem extreme, but we're actually going to be inserting the entire 6 to 8 inches into the rectum. And that's just so that the catheter can get past the initial folds and turns of the rectum so the fluid doesn't pool up there and make us uncomfortable. And it is very soft and flexible, so I can assure you that this won't be painful. And now that we're ready to begin, we're just going to take a small dab of our lubricant. And so you'll just put a little bit on your finger. And then you'll apply that lubricant to the first 2 or 3 inches of this enema tip. And it's also a good idea to apply just a little bit of that lubricant to your anus, because that will just help this glide in a little bit smoother. And now it's time to administer the coffee enema. So first we're going to be inserting this catheter into the rectum. And again, we're going to measure 6 to 8 inches, mark that off with one hand. We're going to make sure our lubricant is applied. And it's good to do this laying down, so you'll get into a comfortable position. You can either be on your back or you can be rolled onto your right side. And with the other hand, you're going to slowly guide this into the anus and keep moving it until you feel this hand that's marking off the 6 to 8 inch mark come up against your bottom, and then you know you've inserted it enough. And at that point, you're just going to roll over to your right side, and so that your bottom of your right side is right over this absorbent pad. And then you're going to get ready to begin the coffee enema. Now I want to back up for a second and give you a little tip. Just in case your anal sphincter isn't cooperating with you and allowing you to insert this catheter, one good way to trick it into cooperating is to just bear down a little bit, so clench your abdominal muscles. And then as you release that clamping, that tension, you begin to insert the catheter at that point. And that usually does the trick. So now that we have the catheter properly inserted, we're going to lay down on our right side and begin the coffee enema. Now we lay on our right side because initially the enema solution will travel up the descending colon, which is actually on the left side. And so if we were laying on the left side, it would actually just pool in that part of the colon and not get distributed to the rest of the colon. So if we lay on our right side, it allows gravity to pull the solution down and get through the whole colon. So now that you're laying on your right side and you're in proper position to administer the coffee enema, we're going to begin. So we're going to use this jar and pretend that this is the colon, just so you can get an idea of how fast the liquid comes out when you administer the coffee enema. And so the first thing you're going to do is make sure you're relaxed, and then you're going to unclamp this tube. Now, it might not be easy to see it, but you'll see that because there's not much gravity in the system right now, there's really nothing coming out. So this is important to understand because you actually have full control over the outflow of the solution from the catheter end, depending on how much gravity you put on the system here. So what you're going to do is just slowly lift up. And so at this point, we just started to get some fluid coming through. And the first time you administer the coffee enema, you should let it come through nice and slow. And so a good place to put this bucket is right on top of this container. And you'll see that it continues to come through at a pretty slow trickle. Some people also put the bucket on their hip too. That's a good place too. It might be a little bit higher than this, so it might come out a little bit quicker. Now, as this is going into your colon, it is possible to get some discomfort. You can feel a little bit of tightness or even some cramping. And if that happens, all you have to do is clamp this shut, and that immediately stops the flow. Another way to stop the flow is just to put this bucket back on the ground, or you can even just pinch the tube like this. And so let's imagine you're feeling a little bit of discomfort and you've stopped the flow. So what do you do next? Well, the first thing is just to take a couple of deep breaths. Usually that's enough to make it pass. If you've taken a couple deep breaths and you're still uncomfortable, then you're going to roll back on your back and sort of rock back and forth. Or you can bring your knees up to your chest and bring your knees back and forth like that a couple of times. And just these subtle changes in your position will help distribute the fluid more throughout your colon and will usually eliminate most discomfort. And then once you're feeling better, you roll back onto your right side, you unclamp the tube, and you continue the enema. And even at this pretty slow rate of speed, you can see that we're already halfway through. And it only takes a couple of minutes to get the coffee in. And it's possible that if there's gas in your system, in the colon, that the fluid might stop flowing. So also, if there's a lot of stool in the colon, it'll be hard to get this liquid in. For that reason, it's a good idea to have a bowel movement before your coffee enema, if you're able to have one. And so we just continue to let this come out until it's all gone through the line. Sometimes our colon just won't let us have the whole thing. And if you're sitting there for a couple minutes and you notice the level of fluid in this bucket isn't changing, it's okay to clamp it shut and to stop at that point. And once you get very comfortable with coffee enemas, you can lift this up higher or even place it on the countertop and do it even quicker. So at this point, you see that there's still a little bit left at the bottom of the bucket. That's not going to really make a big difference if you get it in or not. So once it's done, and there's nothing left in the bucket, you clamp it off again. And then at this point, you have the choice whether to remove the catheter now or to remove it later when you're done. Because at this point, you're going to try to hold in the contents of the enema for 15 minutes. So it's good to have some sort of a timer with you so you can determine that it's been that long. And it's okay to lay in any position at this point. You can roll on your back or on your other side if you want. Whatever keeps you comfortable. And wait for your 15 minutes. And then once the 15 minutes is up, you just get up carefully, make your way to the toilet, and then release the contents of the enema into the toilet. It will feel just like having a normal bowel movement. Of course, it will be mostly liquid. And often, there's a secondary bowel movement that comes within 5 to 10, sometimes 15 minutes after doing a coffee enema. So it's good to just be aware of that and to be near a bathroom in case you get a sudden urge to go after your coffee enema. For most people, it happens within 5 minutes after doing the coffee enema. When you're comfortable enough with the process of removing the catheter, you can remove it as soon as all of the coffee is inserted, if that's more comfortable for you. Now that you've released your coffee enema, it's time to clean the enema bucket. And as long as you clean it regularly like this, the bucket will last you a very long time. So it's important to have your cleaning solution available, and this just consists of a 4-to-1 ratio of water to hydrogen peroxide. And you have the hydrogen peroxide in your kit like I showed you before to make it. The first thing you're going to do is just rinse out the bucket with some hot water. And then you're gonna put just a little bit of hot water in the bottom there. Just about that much. And then you're gonna aim the catheter into a toilet or into a sink. And you're gonna run that warm water through the tube and the catheter. And now that we've run some warm water through the bucket and through the tube, all you gotta do now is just spray down the bucket, just a little bit on the inside, a little bit on the outside with that hydrogen peroxide solution. You can spray the tip of the catheter. If the tip of the catheter is soiled at all, it's perfectly fine to just wipe it off with a paper towel. And then your cleaning process is complete. Now, you're going to do this each time you do a coffee enema. And then the last time you do the coffee enema for the day, there's one last step. And this is just to sterilize the bucket. And that last step is just to pour just a little bit of this straight hydrogen peroxide into the bottom of the bucket. And then just let it run out the line all the way. And once you're done with that, you can just hang it to dry. You can set it wherever you're going to set it, and it'll be ready to go the next day. So if your pad is soiled, or if the towel is soiled, you just use these little bags to put them in. So let's say they're both soiled. There's a bit of a mess. So you take one bag, and you'll put the pad in that bag, and then you'll take another bag, and you'll put the towel in that bag, and you can set them both next to your door, and the innkeepers or the housekeepers will come pick that up for you. If the pad isn't soiled at all, it's perfectly okay to use it again the next day. There's no need to use a new pad if it's not dirty. And that's it.